Hello, everyone. My name is Kevin, and I'm from Central Balance, Dinsdale, Hamilton. And we are a group of professional acupuncturists as well as herbalists who are here to help you achieve your health goals or help you resolve some irritating pains and discomfort. Okay, so I'm doing a live talk today on the topic hip pain. So I'm going to talk about the Western medicine's perspective on hip pain, as well as the Chinese medicine's perspective on this topic. So let's get into it. So let me bring the... Okay. So hip pain. So what is hip pain? So hip pain in Western medicine, medicine's term, they have two names for it. Two syndromes. There are two syndromes. One is called a sciatica, and one is called a Piriformis Syndrome. So what are the differences? So pain felt on one side of the lower back, and buttocks is usually caused by the sciatic nerve, the longest and largest nerve in your body. But because of the nerve's long pathway from the lower spine to get the legs and feet, many structures can contribute to sciatic nerve pain. So sciatica normally occurs when a herniated disc places pressures on the sciatic nerve. But sometimes the nerve can become entrapped by a small muscle called the piriformis. A chiropractor can help you distinguish between Piriformis syndrome versus a herniated disc and prescribe the most appropriate treatment. So what are some symptoms of sciatic nerve pain? So pain in the lower back and buttocks is often accompanied by a burning or tingling sensation that may travel down the back of your leg. While those symptoms are frequently diagnosed as sciatica, misdiagnosis can lead to the wrong treatment that prolong your pain without resolving it. So the symptoms of sciatic nerve pain includes discomfort when sitting, radiating leg pain, lower back pain, burning pain at the back of the leg and or buttocks, tightness in the lower back and buttocks, and pain during hip and knee movement. So Piriformis syndrome and sciatica often exhibit the same symptoms, include discomfort when sitting, radiating leg pain, lower back pain, burning pain at the back of the leg and or buttocks, tightness in the lower back and buttocks, pain during hip and knee movement. So knowing which condition is the root cause of your pain and discomfort is key to successful treatment. A wrong diagnosis can delay recovery, costing you extra time and money, and unnecessarily prolong your pain. So the main difference between sciatica versus Piriformis syndrome is the point at which the sciatic nerve becomes compressed and irritated. Sciatica, for example, often arises from the herniated disc or from degeneration of the lumbar spine that places pressure on the sciatic nerve roots that descends from the lumbar vertebrae. Because the sciatic nerve is the longest nerve in your body, traveling from the lumbar spine, down your legs, and all the way to your feet, compression at the nerve root can cause pain anywhere along its path. Whereas piriformis is also caused by compression of the sciatic nerve, but it occurs at a location further along its path. With Piriformis syndrome, pressure is exerted on the nerve when the piriformis muscle, a small muscle located deep in the buttock, become swollen or tight, entrapping the nerve along its pathway. In some cases, a fibrous band forms within the piriformis, trapping the sciatic nerve and preventing it from gliding freely during normal hip and knee movement. Entrapment can cause painful stretching of the nerve. In physically active people, Piriformis syndrome is often caused by overuse during sports or exercise. So diagnosis to determine if your pain stems from sciatica or Piriformis syndrome. Accurate diagnosis is essential to get the correct treatment to resolve your sciatic nerve pain, but without dynamic imaging, it can be difficult for your doctor to determine if your pain is caused by sciatica or Piriformis syndrome. Okay, so to determine which one is which if it's sciatica or Piriformis syndrome, they Western medicine, they use high resolution diagnostic ultrasonography, as well as X-rays and MRI to help distinguish where exactly the nerve is being compressed. So once the Western medicine get the image and make the diagnosis, and they can move forward to customize the treatment protocol and personalize for the individual patient. So above the information I just mentioned is actually the Western's views or Western medicine's perspective on hip pain, so sciatica and Piriformis syndrome. So, however, in Chinese medicine, we look at things maybe a little bit differently. Okay. So, in Chinese medicine, if you look at the buttock or the hip area at the back, okay, what is actually at the front? Okay, the front, you have actually got in the buttock region, at the front area here, we have actually got the large intestine, the anus. You have the male and female reproductive organ. You have the bladder is also here. And then you have the muscles itself, and you have the buttock muscles that connects to the legs. Yeah. So actually, the pain in the buttock region or hip region has got to do with many things. For example, like what I mentioned, the internal organs. So in Chinese medicine, the sacrum is also not interesting. So the sacrum is actually located in the buttock region as well. And from Chinese medicine's perspective, the sacrum is actually the bone here, as you see in this model. This bone is actually very important for female and male reproductive system as well. So if there's any problem, for example, if the blood or qi is not traveling well, it's got stuck there, it can cause all kinds of issues. For example, reproductive issues or urinary bladder issues. Also, the buttock region also has got to do with your bladder meridian, because you can see the bladder meridian runs all the way down, all the way up. So actually from the foot upwards, all the way up. And you can see it actually crosses the buttock region. So because the bladder meridian comes up from the foot all the way up the leg, when you have problems in the buttock region, you can actually, it might be also be associated to your legs, okay? So as you can see, the bottom region actually correlates to the front area as well as the area beneath the buttock region. So in treatment, Chinese medicine treatment, we often use the buttock region to treat for reproductive issues or if you have leg pains. So these are very important regions, okay? What else have I missed? Just let me check. Okay, so how do we treat the buttock region? We can use needling. So we can needle the balliol points, which are located on the sacrum area. Okay, or we can needle on 环跳, which is this point on the side of the buttock. These are very effective points for treating buttock pain, or if you have sciatica, pain going down the legs. Okay. So another way we can treat buttock pain or pain going down the legs is using moxibustion. So we have a herb called the moxa, and we dry them and then we burn them and then put the moxa close to the body and warm up the body. The moxa is very special because it has a property that can penetrate deeply into the body. So when we burn it, the heat will penetrate deeply into the body. So this is actually very good for people suffering from, for example, lack of energy, because if you don't have energy or qi, if your qi is deficient, then your body's energy does not move properly. So when the energy doesn't move properly, then there's stagnation and blockages. So the herb moxa can actually promote the circulation of qi and blood. And so moxa is actually very, very good for this kind of disease. Okay. So in traditional Chinese medicine, it says that the qi, when it's warmed up, it will start to travel. And the blood, if it meets coldness, then it congeals and stagnates. Okay, so this is why we use moxa to smooth things, to promote the traveling of qi and blood circulation. And when there's a blockage of qi and blood, there is pain. So this explains why sometimes there are pain in this region. Okay. So using moxibustion, we can alleviate sciatic pain as well as hemorrhoids, or even reproductive issues, and particularly for women. If we are able to get the qi flowing in this region, it's also very good for their period pains and to make their period more smooth and also more regular. Okay, so I hope this talk gives you some ideas about what Chinese medicine can do, and also the Western's perspective view on hip pain. Okay, so if you have any questions, please don't hesitate to ask us. I'll be more than happy to help you. You can contact us on this number, 07846 7956. Thank you very much for watching and listening. Okay, we are based in Dinsdale, Hamilton. Please don't hesitate to come and see us. Bye.